Hey everyone, thanks for tuning in and welcome back to Effective Exercise. Stephen here with Team Euphoric, and today I'm going to be discussing how both practitioners and patients can optimize their health and performance by going over the CHEK totem pole. The eighth item on the CHEK totem pole is the sacro-occipital system. The sacro-occipital system refers to the relationship between the sacrum at the base of the spine and the occiput at the base of the skull. This system is critical for maintaining proper spinal alignment and function. Dysfunctions here can lead to a wide range of issues from lower back pain to headaches. Ensuring proper alignment and movement in this system is vital for overall health. Now I'm going to be taking you through some assessments to assess the sacro-occipital system, and we're going to start with pelvic alignment. For the pelvic alignment, what we would want to do is from the side, there should be anywhere from 4 to 7 degrees of an anterior tilt for men and anywhere from 7 to 11 degrees of an anterior tilt for women. That would be considered normal. So what you would do to measure it is you would want to go to the ASIS, or the anterior superior iliac spine, and then the PSIS, or the posterior superior iliac spine. I teach you how to do this in my assessment series playlist. There is a video on measuring pelvic tilt. If you are a member, you'll have access to that video. And in that playlist, there are over 120 different assessment videos. If you are not a member, consider becoming a member for instant access to all of those videos. But you want to take a CHEK inclinometer or some type of inclinometer, place it at the ASIS and PSIS, and see what the angle is. Aside from having 4 to 7 for men and 7 to 11 for women, you also want to see symmetry between right and left. If this is excessively elevated, you would want to perform exercises to bring it more into retroversion. If it has excessive retroversion, you would want to perform exercises to bring it more into anteversion. Then we would want to assess the spine. With regard to the spine, I also go through these assessments in various videos in that assessment series playlist. Just check out measuring lumbar curvature and measuring thoracic curvature. But for measuring lumbar curvature, you would want to mark at the T12L1 and the L5S1, and you would want to see that there's anywhere from 20 to 40 degrees of lumbar curvature. That's going to be a lordotic curve or extension in the lumbar spine. Beyond 40 degrees is hyperlordotic. Less than 20 is hypolordotic, meaning not enough curve. And then at the thoracic spine, you're going to be measuring at the C7T1 and at the T12L1. And same thing, you want to see between 20 to 40 degrees of thoracic curvature. That's going to be a normal, healthy thoracic curve. And then what you would want to do is if it is more than 40 degrees, that is hyperkyphotic. If it is less than 20 degrees, that would be hypokyphotic. And then at the cervical spine, we are going to assess forward head carriage. So you would want to go at the manubrium, and then right at the sternal notch, and then at the zygomatic arch, you would want to see that distance. And if you're using a CHEK forward head caliper, you could use that for this assessment. But you would want to see 0 to 3 centimeters of head carriage. More than 3, they have excessive forward head carriage. You would want to correct that. But those are just some basic assessments for the pelvis spine and the cervical spine. You could also assess mobility in the pelvis. So for mobility, you would want to see what is their mobility like with regard to anteversion and retroversion. What about lateral version? So going up and down. And then you could also check their lumbar extension, their lumbar flexion, thoracic extension, and also rotation in the thoracic and lumbar spine. All of those are in those assessment series playlist videos. So go ahead and check those out if you are a channel member. And if you're not a channel member, again, it's only $5 a month. You have instant access to 120 different assessment videos, plus hundreds of other videos. Next, we are going to move on to some exercises. With regard to the exercises, the first thing that we could do is just some pelvic tilts. So we could do this on a Swiss ball, which you cannot see, they're up in the corner, but for the Swiss ball, you would sit down and you would rock back and forth. So you go to anteversion by sticking the butt out, retroversion by tucking it underneath. So anteversion, retroversion. Anterior tilt, posterior tilt. You could also do lateral version by going up and down on each side. You could also do this from a standing position. So you stick your butt out. So you got the Donald Duck, and then you got the Pink Panther flat. So Donald Duck, anteversion, anterior pelvic tilt. Pink Panther, retroversion, posterior pelvic tilt. Another thing that you can do with regard to the standing one is the lateral version. So for lateral version, with one leg, you would go on the tippy toes, raise it up, then you go down, bend the knee, come down. So tippy toes and down. And then that would be an exercise to help improve range of motion throughout the hips. Some other exercises that you could do, since we are assessing and working on the sacro-occipital system, is all of the LDOAs pertaining to the sacrum, lumbar spine, thoracic spine, and cervical spine. There are dozens of these exercises. So again, I'm not going to go over all of them. However, regardless of whether you are a member or not, if you go to my exercise series playlist and search Eldoa or go to the Eldoa playlist, there are over 700 different exercise videos, and dozens of those videos are going to be the Eldoa exercises. So go ahead and give those exercises a try. The next thing that we could do is all of the deep muscles that are responsible for stabilizing the spine. We want to strengthen those. So things like farmer's carry, where you're holding on to a single either farmer's carry handle or dumbbell or kettlebell and just walking with it. That's going to be great for the muscles such as the quadratus lumborum or the QL. And then there are a bunch of exercises to focus on the multifidus, the rotatories, and all of the really important spinal stabilizers. Another important spinal stabilizer is going to be the transverse abdominis or the TVA muscle. And again, you can check out that playlist. Just type in TVA strengthening for all of those videos. But for now, we're going to be moving on to the next item on the CHEK totem pole. Thanks for sticking around until the end of the video. Be sure to like, share, and leave a comment as it'll help the algorithm. And if you enjoyed the content, show your support by subscribing to the channel by clicking on the icon in the bottom right corner. And if you really want to show your support, then consider becoming a member by clicking on the icon in the bottom left corner. These new high-quality videos aren't cheap to edit, and the $5 membership will really help with the video editing budget. You'll also get access to a ton of exclusive perks like early access to videos and this program design lecture playlist in the top right-hand corner. And if you want to learn how to do a one-armed pull-up, then check out the playlist on the top left corner.